Thank you, Madam Speaker and members of this House. Today is a very important day for me and for my district as we talk about one of the things that many of us in this room have campaigned on, have talked about all year. And here we are at the end of session, and we should each just ponder and explore our legislative records. What have we done in terms of legislation to offer some measure of health care to our constituents, to offer some measure of health care to Californians? You know the answer. Many of us have not done anything at all. We've complained about every offer of a proposal for health care for Californians, and at the end of the day, here we are, the day before the close of session. And as we campaigned on health care, we find ourselves offering nothing. Clearly, there is no other proposal that I know of right now at this time that we can offer Californians about health care. It's easy to throw a rock. It's easy to tear down. And while it has been difficult for some of us to tear down, it can be easier to build up. We can build Californians up and support this measure. For me, I know that this is an important and historic measure because I had an opportunity to have a town hall meeting with my constituents who are more important than any concept to be discussed today. They met with Sumi Sosa from the Speaker's staff as she appeared at our town hall meeting in South Los Angeles, and they understand the impact of AB 8. Corporations, many of whom are making multi-million dollars and not paying one red cent for people who are working with them. They deserve to be accountable, to be responsible in this state, to make sure that they do their share, running around with a free ride and leaving people who are Californians to depend upon what for health care. I support AB 8 because it is also important for us to realize that children in this state, vulnerable children, many of whom, all of whom, didn't ask to be born, and we can do something as legislators. I support AB 8 because AB 8 is the only thing standing. Many people talked about a proposal. Nobody offered us a bill. And if I am wrong, correct me when I sit down. There is no other bill right now in this session that offers health care to Californians. And so, ladies and gentlemen, my colleagues, nothing is more important in life, not even $1 million. What good is $1 million if you don't have your health? Not only our health is important, but the health of the people who voted to put us here, that is also important. Ladies and gentlemen, this is a historic moment. You are a part of this history. Where will you stand? Dr. King wrote a book, Why We Can't Wait. Many of the reasons I've discussed is why we cannot wait. We cannot wait because our constituents need health care. We cannot wait because vulnerable children, Californians, need health care. We cannot wait because there are corporations who have millions of dollars who are paying nothing for people who are working for them. Why we cannot wait? We cannot wait because California needs health care. I ask for your aye vote on the only thing left legislatively standing in California today. That is AB 8. Thank you.